Hello everyone, welcome to my channel. This is Dr. Vivek Choudhary and I'm going to teach you anatomy on this channel. So as there are so many volumes of BD Chaurasia. So first we'll start with the general anatomy and then we'll follow the other volumes. So if we talk about the general anatomy, let's discuss the contents of the general anatomy. So if we what we study in general anatomy is the basic things about these structures, body structures, as we have studied in the school level. So let's talk about the contents. So if we talk about the contents, so you can see first we'll discuss about the introduction part, like what is anatomy, how it is developed, how it's discovered, what is the basic things that we focus on while studying the anatomy, the basic terminologies. After that we'll discuss about the different body structures like skeleton, that is your bones, the framework of your body, and then we talk about the joints, like how the bones are attached, the classifications of joints, how many joints are there, type of joints, what is the functions, movements, that is very important in the locomotion. Then we'll talk about the muscles. As you know, the muscles are very important in the body movements. They help in the contraction, relaxation, the different things. Then we'll discuss about the classification of muscles, type of muscles, the structures. Okay, then we'll talk about the body system, that is your cardiovascular system, then lymphatic system, then nervous system. As you know, the cardiovascular system deals with the heart and the blood circulation. Then the lymphatic system, the lymphatic drainage, that is the specialized connective tissue that helps as a mediator between the blood and the different organs. Then we'll talk about the nervous system. Nervous system is basically most important for our conduction of the nerve impulses, that helps in the complete control and coordination of the body. Then we'll talk about the skin and the fascia. What do you know about the skin? That is our body covering, very important. It is a protective, different functions are there. Then we'll talk about the connective tissue, ligaments and raphe. These are the very important structures. And then the last we'll discuss about the principles of radiography. As we know, radiography is very well known technology used to study different body defects and damages. So this is all about your general anatomy introduction, and this book is very important as it has a very good, as we can say, good weightage in the anatomy exam for the first year, and it is very scoring. You can learn easily about these basic things as you have studied earlier also. You just have to revive little bit. Okay, so let's start without wasting the time, the introduction of the human anatomy. So as we know, human anatomy is the science that deals with the structures of the human body. As we know, we are studying the human body, and there are two terms. One is the anatomy and the other one is the dissection. They both are equivalents, but as we know, the anatomy is a Greek word that means cutting up, but dissection is a different thing. Okay, so dissection is a mere technique. It's just a technique which we use to study anatomy, but anatomy is a wide field. It is basically a subject. You cannot say it is totally equivalent. So basically guys, anatomy forms firm foundation of the whole art of medicine. As you know, when we practice medicine or we study medicine, you have to know the body parts, different parts of the body, so like you can easily know what is going on, how it is going on, where it is going on. Okay, like there is a term, anatomy is to physiology as geography is to history. Okay, it describes the theater in which the action takes place. This is very important as the relation between anatomy and physiology. Then if we talk about subdivisions of anatomy, so there are different types of anatomy that we study. So first is the cadaveric anatomy, in which we study on a dead embodied body, usually with the naked eye. Okay, it's a macroscopic technique or basically gross anatomy, in which we can study the body parts in different types, like regional anatomy, the body studied in parts. Okay, like the volumes are there: upper limb, lower limb, thorax, abdomen. And then in systematic anatomy, the body is studies in systems like the skeletal system, the muscular system, the vascular system, respiratory system. Okay, there are so many things, and there are different names for that. Like if we study the vascular system, it is called angiology. These terms you should know. Like we study the nervous system, it is called neurology. And if you talk about endocrine, then splanchology. So there are so many systems that we study in cadaveric anatomy by cutting the dead body and studying it briefly. Okay, so let's talk about the second subdivision, that is our living anatomy. So in living anatomy, we study the body by different methods like inspection, palpation, percussion, auscultation, and endoscopy. So if you know, palpation is a technique by which we put pressure with the help of fingers or hands and do the physical examination of the different body parts. Like we determine the size, consistency, and borders of the body organs or the presence of any fluid in any areas. Okay, the percussion is a different technique, the type of physical examination in we hit the body parts by tapping fingers or hands, like we hit the drum or any instrument, musical instrument. Okay, then we'll talk about auscultation. Auscultation is a technique in which we study the different physiological conditions with the help of stethoscope. Okay, basically when we use stethoscope, this technique is called auscultation. And then, so if I brief about the endoscopy, endoscopy is a medical procedure that allows a physician to observe the inside of the body. How? It uses a long flexible tube with a lens at one end and a video camera at the other. Okay, so the end with the lens is inserted into the patient. That lens reflects the images to the video camera in which we study different body parts inside. Okay, and it helps to see the parts inside without any major surgery. It is a very good technique. Okay, then we'll proceed further. Then the third subdivision is the embryology, that is the developmental anatomy, in which we study the prenatal development. That is very important. We talk about the fetus here, the development of the baby in the womb of the mother. Okay, we see all the developmental changes step by step and study from first month to the ninth month till the delivery of the baby. Okay, then there's a term ontogeny and phylogeny. What is the meaning of this? Ontogeny means the development history of the fetus, and the evolutionary history is known as phylogeny. Okay, then next comes the histology. Histology is a microscopic technique in which we use microscope to study the structures inside at a microscopic level. Okay, like tissue level, cell level, cellular level, we study the different microstructures of the body. Then we talk about the surface anatomy. It is also known as topographic anatomy. So surface anatomy basically deals with the deeper parts of the body. What we do, we study the skin surface in relation to the deeper part. We locate the different organs or different body parts on the skin in relation to the deeper parts. Okay, like you can see in this diagram, we are locating different bones or muscles, or we locate the heart, borders of the heart. So it helps to know, like it is very important in the surgery part. When we do the surgery, surface marking is very important. Okay, so surface anatomy is a very important field in the surgery. Then we talk about the radiographic and imaging anatomy. It is the study of the bones and the deeper parts, as you know, by plane and contrast radiography, by the ultrasound, and computerized tomography, CT scans. So these are very important techniques to study the inside body part by imaging process. Then like we can see the example, there is a chest x-ray. Okay, x-ray of chest, there is plane radiography it is called. You can see what happens there, where the bone is there, it reflects other than it passes, and then it shows the image of the chest. Okay, so this is the radiography. Comparative anatomy. Comparative anatomy is the study of anatomy of the other animals to explain the changes in form, structure and function of different parts of the human body. Basically, it is a comparative study between the animals and the humans to study the evolution in different parts, that is morphology and anatomical parts. Then we talk about the physical anthropology, which deals with the external features and measurements of different races and groups of people, and with the study of the prehistoric remains. Okay, so this is physical. And then there are next are the applied anatomy, experimental anatomy and the genetics. Applied anatomy is a very important aspect, that is a clinical anatomy, in which you will deal with the application of the anatomical knowledge in the medical or surgical practice. Like when you go to the OPD or you go to any surgical practice or medicinal practice, you will relate the anatomical knowledge to the particular disease, particular pathology. You can relate how this part is related with that particular problem and how we can resolve it. Okay, then experimental anatomy is the study of the factors which influence and determine the form, structure and function of the different parts of the body. It is not that much important. Then we talk about genetics. You know all genetics, the study of the information present in the chromosome. We all have studied at the school level that what is the importance of genetics in the anatomy. Then further we'll discuss about different planes of the anatomy, different terminologies. We will discuss this up in the next. So thank you guys for watching the lecture, and if you enjoyed this, please do follow, subscribe the channel, and you'll wait for the another lecture.